Okay. That's right, Izzy. Lovely, thank you. Hello everybody, welcome to the Dorset Health and Wellbeing Board of the 24th of March. We've got a really good agenda today. There's quite a lot on it. So really welcome contributions from everybody around the board. But if there is something that where people have read a report before, then those who are presenting, I think we assume that members have read whatever they have received. But remember, this is also a public meeting, so of course we want them to hear your voice as key members of the health and wellbeing strategy today. So the first item on the agenda is for any apologies. And
would you like me to go through those?
Please.
Okay, we have apologies from Tim Goodson, Patricia Miller, Danny Farrell, Martin Longley, James Vaughan, but Mark Callahan is here for substitute, and apologies from Simon Raw, but Chris Spackman is here as his substitute.
Lovely, thank you very much. And I know Patricia tried to get a substitute as well, but they had an emergency meeting. And we also welcome to Chris and Mark standing in for James and Simon. We also have another Mark House, who is a new member to the board representing the Dorset and Wiltshire Fire and Rescue Service. And Seth, we thank for his contribution. He will now be Mark's substitute. So welcome, Mark.
Thank you, Chair.
Right. We will now move on to the minutes of the last meeting. Does anyone have any anything on the minutes which is a matter of accuracy to amend? I'm not seeing any faces. By the way, just housekeeping. I will keep an eye on the chat and the hands up if you've got it. So please use both, and please keep your videos on if you can. I know some people have broadband problems, but it's always nice to see faces rather than blank screens. And obviously, if you have a parrot or a dog, you might want to mute your microphone. Now that applies to me as well as others on this meeting. So we'll now go on to minutes. Is there anything anyone would like to raise under the previous minutes that isn't being covered in the meeting today? No, I'm not seeing any hands or chats. So I will sign those with your agreement. Thank you. And now move on to declarations of interest. Are there any declarations? Not seeing any. No. So I'll move on to public participation. And Fiona, I think we confirmed there is no public participation today.
No, there isn't. That's correct.
Thank you. The next item on the agenda, number 5, is the Local Outbreak Engagement Board update, and that is from Sam Crow, our Director for Public Health. Over to you, Sam.
Thank you very much, Rebecca. Good afternoon, everybody. So I thought I'd just start with a very quick recap on where we are with COVID-19. We're in a much better place than we have been over the previous 3 months. The infection rates are coming down. A little bit slower in the last couple of weeks, but they're now down below 30 per 100,000 in the Dorset Council area, which is very different to where they were in January. Just to cast your minds back, 3 months ago, we had an infection rate which at one point topped well over 300 per 100,000 in a 7-day period. So to see that come down has been an enormous relief. So the context now around the work of the Local Outbreak Engagement Board and the Health Protection Board is about turning our attention to thinking about how we live with COVID-19. Obviously, the Prime Minister's roadmap's been published, and the Contain strategy, which sets the framework, the national framework for how we respond to COVID-19, has also been refreshed and updated in the past week. So we were given a very short timescale to turn around a refresh of the Local Outbreak Management Plan. You'll have seen a very draft early version of the plan, which went out with the papers. That was required to go off for the first stage of assurance on March the 12th. It's had that assurance feedback from the regional working group, and the plan has passed muster. So it's comprehensive in all of the main areas that they would expect a local outbreak management plan to pick up. It now goes on to a final stage assurance process, and the date for sign-off is the 2nd of April. But I thought I'd just spend a little bit of time just picking out a couple of themes from the plan, and also to give some background as to why we've written it in this way. Just to remind the Health and Wellbeing Board, there's a very clear link between the Health Protection Board, which is the sort of officer response across the system to dealing with COVID-19 outbreaks, and the Local Outbreak Engagement Board. The Local Outbreak Engagement Board holds the ring on our communications approach. So we meet as a Health Protection Board when we're considering our response to the local situation, but we meet as a Local Outbreak Engagement Board when we need to think very clearly about the communications that needs to go out and how we might work with communities to tackle COVID-19. So the plan itself sets out the role of the Health Protection Board. It starts to put together a work programme over the medium to long term, really picking up on 4 priorities that I feel are going to be important as we prepare to live with COVID-19 over the next year. The original plans were first required in June 2020, and we took the decision this time round not to revisit that plan as it was written back in June 2020, mainly because so much has changed. And there's been a complete turnaround since that time from national to local delivery and assurance around outbreak management. So if you look at the developments that have happened since the summer last year, we're now in a much better place as a Health Protection Board working across 2 councils to deliver rapid contact tracing, much better testing capability, including rapid testing for asymptomatic COVID. And I think for that reason, having a plan that was forward-looking rather than reaching back and building on what we wrote at the time was the most sensible step. So the approach this time has been to prepare a single plan under the Dorset Health Protection Board. It covers both unitary council areas, and it really sort of highlights the role that the board's played over the past 9 months, and reframes the fact that they remain the main accountable body for the work going forward, and some of those themes set out in the plan. The 4 priorities that we've structured our thinking around are about keeping transmission as low as possible, ensuring that our surveillance for COVID remains optimal, so the epicell will continue, and that includes surveillance for new variants, making sure that our testing capability is effective and that we can contact trace quickly, and also to relook at the support on offer through both councils to enable people to self-isolate effectively. And the final priority is about vaccination. So although we're not responsible for delivery of the vaccination program through the Health Protection Board, what we are very interested in is making sure that we don't have huge gaps in the way that the vaccine has been taken up across our communities, and to work with our colleagues across the system to make sure that we've got a very clear plan to tackle inequalities in vaccination uptake. Within the plan, you'll also find some of the lessons that we've learned over the past 9 months, and we've also tried to showcase some of the experience that partners have gained from responding to the huge number of outbreaks that affected not just our higher risk settings, but also our communities as a whole. A major section deals with how we start to support the opening up of our local communities, make sure that we do that as safely as possible, and the role that the Health Protection Board will continue to play in giving public health advice to the system as we look at how we live safely with COVID over the next few months. And just a reminder, we've also tried to capture the impact of COVID in the plan. Yesterday was obviously the National Day of Reflection. We just passed the anniversary of the first lockdown, and when we put the plan together just before March the 12th, our sort of running tally was almost 40,000 people under both councils having tested positive for COVID-19, probably an underestimate because of the lack of community testing that was available in the first phase. Nearly 1,400 people who've lost their lives within 28 days of having had a positive COVID-19 test, 365 incidents and outbreaks that have affected education settings, 588 incidents and outbreaks in the care homes locally. We've had outbreaks across all 3 of our major hospitals, as well as around 40 outbreaks affecting our other healthcare settings. So it's just a reminder of just what we've been through. We feel we don't want to dwell on that. We don't want to necessarily look back, but it is important to acknowledge it. It's had a huge impact, but this plan is very much about looking forward and thinking through how we perhaps, live with COVID as opposed to being in a sort of pandemic phase. So the theme is very much COVID-19 as an endemic infection in our population, and we hope that we won't go back to that situation where we saw those very, very serious surges, the last of which was 3 months ago. And then finally, the last part of the plan is just thinking about some of our risks and challenges going forward. There's lots of detail in the plan, but the main risk that I see is the risk of loosening those measures too soon, not just because of what the roadmap allows, but because of the psychology involved. So the public are very fatigued. No one wants to be in lockdown for longer than necessary. There is a risk that as we do start to open up, some of the behaviours may well happen in advance of the stages under the roadmap. So we do need to continue to work together and be very, very consistent in our messaging and remain very vigilant for any signs of an upturn in infection. So other than that, I'm happy to recommend the draft report to the Health and Wellbeing Board, and just to note that we'd hope to send around a final designed version probably over the next 7 days once we've had that second stage feedback from the National Assurance Group. Thank you, Chairman.
Yeah, great, thanks, Sam. Questions, either hands up or in the chat box. And Laura, you've got hands up, please. Thank you.
Thanks, Rebecca. Laura Miller, Cabinet Member for Adult Social Care and Health at Dorset Council. I just want to thank Sam and his colleagues for this. I don't have anything further to add, really, apart from that I would simply pick up on Sam's last point about stressing that real consistency of communication, because I think where we've seen that perhaps maybe centrally not happen, that's when we've seen the confusion amongst our communities, and it's beholden on all of us as community leaders to really keep that consistency going. I just think that's probably one of the most important things, apart from all the technical detail, and thank you to Sam and officers for that, but really stress that consistency of approach, because that's what's going to get us out collectively, but back to whatever normal looks like. But thank you, Chair.
Thanks, Laura. And just to add, thank you to all the teams that actually sit on the operational side, particularly the comms people, because I know there's a big strategy going on to plan for visitors to the county, working with the police in particular and the highways. So John, your team there's a huge amount that's going to be happening, which the public hopefully won't actually see a great deal of disturbance like we had last year, thanks to all of that hard work which is going on. Spencer.
Thank you very much, Chairman. I wanted to add to what Laura said, really, because we are obviously planning for the reopening of Dorset. We're going to get a lot of visitors in Dorset. There's no doubt about it. A pent-up desire to get back out there and come and enjoy our county, but act responsibly, I think, is one of the key messages. And also, we have to appreciate the impact it has on the population of Dorset as well. And I think it's a really strong message here. And Sam touched on the roadmap. I mean, there are pressures nationally and probably locally as well around why are we waiting so long. My view is learn the lesson from the Isle of Man. They went 4 weeks ago. We haven't got any infections, and within a fortnight they were back in lockdown because they went too early. And I think doing it in a phased way, respecting the channel, the dangers of going too early is absolutely right. And I'm very encouraged by all the multi-agency work that's going on to ensure that we do as best we can to mitigate the impact of what we will have a lot of people wishing to come to Dorset and enjoy our county, and why wouldn't they? What a great opportunity to offer this So they come back year after year. They don't just come back this year, they come back again because they like what they saw. And I think the main message for me is come to Dorset, enjoy yourselves, but please follow the guidelines and act responsibly. Thank you, Chairman.
Brilliant. Thank you, Spencer. Is anyone else want to? Forbes?
Thank you.
Forbes, then John.
Okay, I did see John's hand. Okay, I'll go. Thank you. It really just from a health perspective to absolutely reinforce our support for the comments that have been made. First of all, thank Sam for the plan. I thought it was a really comprehensive and informative read. But actually getting to the easing of restrictions, I think we mustn't forget the amount of healthcare that has been unable to deliver to the residents of Dorset, particularly in the acute sector, because of the demands of COVID. We have many of our residents waiting far too long, quite honestly, for routine operations that have had to be postponed because of COVID. If we see another COVID spike, that could further delay those residents getting those procedures. So again, please, everyone, whether they live in Dorset or are visiting Dorset, continue to follow the rules with respect. The other thing, just to touch on, we are in the public domain, is the vaccination program. The vaccination program so far has gone extremely well. We are, of course, limited by the supply chain, and Sam has alluded to the work that's going on to try and minimise the variation in terms of vaccine delivery. The other point I do want to make is if anyone who's within one of the cohorts that should already have been vaccinated has not heard about a vaccination invitation or appointment, then please get in touch. It's probably a simple communication thing, perhaps through a mobile phone number not being correct. So really just anyone who's listening, please get in touch with your local, either your local practice or vaccine centre. There will be a vaccine for you.
Brilliant, thanks, Forbes. It has been amazing in Dorset. I know we're ahead of all sorts of levels, but that's really brilliant. John, I think you waved at me.
Thanks, Chairman. Just to pick up your point and the point made by Spencer about the safe summer opening, we've got a few simple summary slides, which I know are familiar to many on this call who's perhaps saw them at the webinar last week. But just for completeness, it might be helpful, particularly if our partners had got those well. So I can let Fiona have those that can be shared around. They just very simply summarise what Spencer was describing a moment ago, and just might be useful as background to colleagues who've not necessarily had that through our internal communications.
That's brilliant, and I think Chris Spackman, who is here on behalf of Dorset Community Action, Chris, you put a note in the chat about those comms channels that you have. So sharing as much as we can with Chris and his organisation. Yeah. I know Laura, you're on it already, so that'd be really good.
Yeah, we can direct some of this out to local community groups we know. And they've got really good communication links into their communities, and they're also trusted. So that might be a very good way of getting people to be more compliant with releasing of the lockdown.
Brilliant. Okay. Are there any other hands, waves, or chats I haven't seen? No, I think we'll move on. But that's really assuring that everyone is engaged with this. Really, really good. The next item on the agenda is the health and wellbeing strategy, and I've got Sam and Paul doing a double act. So I hope you're both here. I know Paul Sam is. I'm sure I said hello to Paul. Yeah, there you are, Paul. Okay, over to you two.
Thank you very much, Rebecca. I'll hand over straight to Paul, if I may. Paul will be able to do the paper far more justice than I.
Thank you, Sam. Thank you, Chair. And a swift apology on my part. I noticed with horror earlier that the cover sheet is incorrect to this paper. Inadvertently, we seem to have shared the cover sheet from the previous meeting, which invited comment on a draft. We talked about, we discussed at some length the health and wellbeing strategy in November, and that's noted in the minutes of the meeting. I took away an action to update the strategy in light of that conversation. and made some changes. The major one being on page 4, which seeks to remind us that empowering communities and addressing health inequalities isn't limited solely to activities that would take place in Weymouth and Portland, but that we have needs across the county, and that we would seek to be working proportionately to those needs across the county. So that's the main significant change. We were merely looking for a final sign-off today from the board.
Thank you, Paul, for that explanation. A really good piece of work. And the thing about these strategies is that they do need revisiting quite a lot more often than they ever used to, due to the changing, whether it's changes in health or the geography, the circumstance of us all. So to keep it up to date, I think it's quite a task you've got, because we keep wanting to add in more things, and there's more and more that we want to put into these strategies, and we can't put them all in, but you've captured it really, really well, so thank you. Forbes, you have your hand up. Forbes?
Thank you, and happy to support the strategy. I wasn't involved in the conversation in November, but there's just a stark fact there, really, and we're talking quite a lot at the moment about variation, and it's the life expectancy gap that exists in Dorset still. And quite honestly, we're not closing that over the years at all. To see a gap of 16.9 years for men and 17.6 years for women, that really is significant indeed. And just reflecting on our various integrated care system conversations that we're now having, then I think we need to keep that in focus.
Yeah, you're absolutely right, and to bring that this into the ICS conversation is really helpful, because there's such a powerful link, isn't there, between what we discuss here and when it's part of the ICS project that we're so many of us are involved with. So thanks, Forbes. Are there any other comments on this? It's a living document, isn't it? And I think we should be aware of what we need to deliver, but also be aware of the data. That's really, really important, because it can change so dramatically, or not, as Forbes has pointed out. We should be making a difference there. Chris Spackman.
I was just wondering how you've managed to reflect what's been going on in the communities over the last 12 to 18 months, because there's been a significant change. An awful lot of new groups have established. There's a lot of the work that would support the strategy, but they're not formalised and they're not really incorporated into any sort of end-to-end processes or linkages back into the statutory services. So I think there's a tremendous opportunity out here to build on what's happened during the COVID crisis, and actually try to make some of those small groups more sustainable and to have more formal links into the statutory services.
Is that something Laura or Teresa or Vivian you'd like to comment on?
Thank you, Chair. I can comment briefly on that. So yeah, you're absolutely right, Chris. We, a year ago, set up Dorset Together, which was a meeting which Teresa chaired, and I was political representation on, and that brought together community, voluntary sector, small enterprise, people into one room to discuss how we were going to deliver that support that communities needed. That met daily. Now it's meeting weekly. It's moved very much into a place where what next? So we know that we don't have those people immediately saying we need food, we need stuff, help. We don't know what we're doing. That was very much our focus a year ago. Now the focus of that group, and I dipped into it briefly today, the weekly meeting, is very much on how do we build on these relationships that we've managed to foster over the last year, certainly from an adult's point of view, and I think probably from a children's point of view as well, but certainly in my world, we now have most of those groups sitting on our transformation board, so we have them as stakeholders So I chair that stakeholder board for A Better Life, which is our adults transformation program, and the idea really is that absolutely the message we heard loud and clear from those groups during the last year is we can do this. Please let us. Please enable us. And that's absolutely the space that we're moving into. So it's a great point. It's one of my biggest kind of things that we have to harness, that we have to capture it. And I would say actually that, you know, it's going to be a long road. It's a big deal to change how we commission and change how we work within our communities. But actually we've got the impetus now, and we're very determined not to let that go. So thank you for highlighting that.
Thank you.
Thanks, Laura. Vivian, do you want to follow up on that point?
Yeah,
and well made.
And thank you, Chris, because I think it goes to the root of what we're trying to do over what we were trying to do pre-pandemic, but definitely it's really pushed it forward and really shown the value of where our communities want to be with us and how they want to work together to provide both that prevention and support, but also that support alongside more traditional type support that has been available via commission services. So I think we're excited is what we like to really you know, have that sort of on board, and that enthusiasm that will turn into real action now, and we're beginning to see that. So yes, I'd echo everything that Laura's saying, but we are absolutely aware now the value of our communities and how we can work together to really support and change that sort of health and well-being approach to our communities. So really thank you for bringing that up.
So there is a place, Chris. I hope that the connections are being made here and taken away, and maybe Tony Meadows with a hand up, you can also comment on that. You're at the heart of this.
Thank you, Chair. I think just to sort of reiterate it, in terms of a lot of the opportunities of working with the voluntary community sector in the past have been hampered, I think, by either we've got the process of grants or we've got the process of contracts, and it's very difficult for the sector to engage in the contractual element. We have opportunities, the new sort of lighter touch regime that's coming in around procurement, and also, to be honest, what we're doing with the Dorset Care framework now. So we've had our first framework in place for a number of years. We are now working on the reopening of that framework, and it is going to be established in a way that there will not be barriers to small organisations actually joining that framework, to enable a lot of different solutions to sort of be achieved from our strategic objectives, and also to support those organisations as well to engage in personalisation, accessing other routes of funding around personal budgets, direct payments, all of those sort of things. So it's really just to say, you know, we can talk the language about engagement and everything else, but actually the means of funneling additional funding and, shall we say, bringing that community sort of perspective into things, we've got to have the tools to do it as well, and that's also on the agenda.
I think also it's useful to try and get some of these groups more sustainable as well, because they're often set up with a very short-term goal, and I think there's an opportunity now to go and support these groups to get decent governance in place, volunteer management, training, all those other things in place now. So we've got something permanent and long-lasting. There's a tremendous potential out there.
Great. Okay. Thanks very much. And Paul, I think all very much welcome your work on the strategy. It's now actioning the strategy and filling in those boxes which that need to be filled and taken forward, and less of the silo work. It's so good to hear that there's a real partnership working going on. So the next item on the agenda is the J8, and that's Paul with Natasha.
Thank you, Chair. Back in September last year, I presented with our colleague, or former colleague now, sadly Chris Skelly, has left and joined Public Health England, but he came to the board and gave us an overview of the JSNA Insights panel's work. Nat has kindly agreed to join us today to give us a little bit of a review of the end of life panel that has been conducted. Despite COVID and lockdown times, they've shifted the process into a virtual environment, and Nat's going to talk us through the findings of that end of life JSNA Insights work.
Hi, thank you, Paul, and thank you for inviting me along to the meeting today. I have some slides to share, if that's okay. Let me just set that up a second. Okay. Do shout if you can't see anything. I think with presenter mode, I might lose visibility of the Teams meeting. So please do let me know if there are any questions. But I just thought I'd share a bit of an update on the findings from the end of life care panel that we were able to run over the last few months, and also explain how we managed to move it virtually, bringing together lots of stakeholders to discuss this topic and trying to replicate the interactivity that we had through our face-to-face process. Okay, so originally our JSNA panel process, where we work through topics with a group of stakeholders, we'd have a set of 2 face-to-face workshops. And what we set up with the end of life care panel was, again, facilitating in that workshop manner, but using tools such as Miro and Teams to allow us to have interactive conversations and bring in broader groups that might not be able to attend the traditional face-to-face workshop where we go to a venue for half a day. It allowed us a little bit more flexibility to talk to other groups. So the process we went through for the end of life care panel was an initial interactive workshop where we set up a systems map to discuss the drivers and some of the barriers in providing good end of life care experience for people. We were able to then share that with colleagues to refine outside of the workshop, and we were able to test it with wider groups. So in this example, we were able to have a group with care homes and domiciliary care providers. And we were also able to speak to people with lived experience to get their really valuable perspectives as well on the topic. And we allowed us to collate all of that back into a second workshop. And then we're now in the process of writing that narrative and needs assessment document. So we used an online tool called Miro for collaboration, which was trying to replicate the process of system mapping. So using systems thinking and system mapping lets us work with a wide variety of stakeholders to share all of their experiences and perspectives on an issue and draw a visual picture of how they see the system working and the challenges that they identified. So this is an example of an initial map that we collated with them in that first workshop. And we were then able to develop that further by talking to groups, and in that second workshop stage to try and pull together a clear narrative of what were some of the key challenges in this area. So we knew from national and local data and national research that people's choices and expectations and wishes can be quite varied at this difficult time in life. And it's really important to understand what matters to people and their loved ones at this time. And we know from national research that there can be quite a variation in the experience that people have at this time. It could be down to the diagnostic needs that they have, or their own choices and wishes, and being able to support that consistently across a wide variety of settings and services is really important. So some of the key challenges that they identified in the workshop was that having that really appropriate and timely care, which is important to people, is really dependent on having really excellent inter-service relationships. So we've got lots of specialist services delivering palliative care, but there are also lots of services and people whose roles involve providing some end-of-life care, and it's really important that there's some good inter-service relationships there, so that we understand all about that person and their needs. The other challenge that was identified was that having a clear care plan understood by all is really essential to support that experience, and it's a really good sign that we've got a well-functioning system. And we also talked about the importance of workforce wellbeing and resilience. That was something identified by all the stakeholders as a key factor. Because this time can be difficult and can be emotionally challenging, and workforce have a really important role in creating relationships and having conversations to understand people's wishes at this time. It's really important that we support wellbeing and resilience. So that was a key challenge that this group identified. So in workshop 2, we also help to look at where can we make changes in our system to work towards our values and our goals. So in this panel, the goal was to understand what a good end-of-life care looks like, and how do we work towards a strategy that the panel and the group were working on. So we could use these online tools to start to show visuals to share people's ideas of where are there opportunities to improve things, and where is there opportunity within our systems to look at supporting change. And in our systems thinking process, we're thinking about leverage and the different points where we can make changes and improve things to help support us achieving our goals. So we can look at events and patterns, and there might be some quick changes we can make, but we can also look at some of our underlying goals within our system and beliefs and values, and think about where we can change things that might have longer lasting or more transformational change. And some of the things that the group identified at that time was shifting system norms towards understanding what matters. So really making it the norm, no matter the role, the service, the situation, to be really understanding what matters and what's important to that person and their loved ones or family members, and why. And also improving communication between agencies and collaborations to help support those inter-service relationships. And they identified that they really wanted to develop a shared vision and a shared aim with all of those partners together. So the outputs of the JSNA panel and working virtually as well is that we have an online map that can be shared, which is a visual description of those challenges and all of the conversations in the workshop. And we're putting that alongside a more traditional report, which pulls together some of the data and ties it in with the conversations and the outputs from the workshops. And I thought it'd just be nice to share some feedback from the panel. Obviously, this is the first time that we moved this completely virtual, and through the period, we were all trying to work with moving towards online meetings and things. And I thought it was useful to just share some of the things that the panel found useful at the time, and how we've managed to capture the things they valued from the face-to-face experience, which was really those sitting and having those really in-depth conversations about issues together and mapping that out as a system. And they felt that we'd managed to capture that online and repeat that experience. And they're hoping to use this as a building block to develop their strategy across Dorset. So I think that is my slides. I will come back to the meeting view, and if there's any questions.
Teresa.
I think Teresa.
Yeah, thank you, Natasha. I mean, not so much a question, just a comment, really, the power of that message, isn't it? You know, just what was it that really mattered? And it's so often a surprise. It's not the things that we've been counting, is it? It's the other things. And I think that's just a really, really key and important message, isn't it, for anybody that's ever been anywhere close to that end of life work. It's just really listening hard and listening long. Yeah, thank you. Really lovely presentation.
Thank you, Teresa. Hi, Sam.
Thanks. I'm really pleased to see this come to fruition here today, because we've been struggling with the concept of joint strategic needs assessment, I think, for many years. And what started as a statutory responsibility between health and wellbeing boards and CCGs to collaborate and sort of come together and think about how we approach some of the priorities in our population. I think sometimes we lost sight of it, and Teresa summed it up beautifully. You know, the things that we can count and the things that we can measure are often not the things that are deep enough to really affect lasting change. So when we were first describing this method and the idea of bringing people together to think through at different layers what might be important and what might really be going on beneath the surface, it might have just been projection, but I think I detected a little bit of skepticism from some people who were thinking, you know, where's this going to go? What's going to be the output? But from many years around this topic, I've realised that the technical side and the public health information and the needs information only gets you so far. You really need to build that powerful story that's going to ignite people and help people bring to the surface what we feel we can really change. And I think these panels, from what I've seen, are a really powerful way of doing that. So just pay testament to the skill of the team and the people involved in sticking with it and developing that process, and I hope it's the first of many more. Thank you.
Thanks, Sam. I think I have a question from Vivian. Hi, Vivian.
Hi, and I would just like to thank you. I mean, for your presentation, and you know, as people have said, you know, really powerful, and particularly at this point in our journey. I think, you know, it's very poignant that we're seeing it today, you know, 1 year on, and our experiences of what people have gone through, you know, just brings all of that together. You know, what that just the line you mentioned about what matters to people, you know, doing what matters has been the most powerful thing throughout this process. And I think when you are involved in palliative care or end of life support to people, you know, that individualized approach and that really listening is the most powerful thing that we can do. So yeah, really just like to thank you. And I think it's so powerful approach and really useful in terms of how we look at how we work. So yeah, brilliant. Thank you, Natasha.
Thanks, Vivian.
And thank you, Natasha. I think it as others said, it really shows that this is a health and well-being issue. Some people have thought, well, what's that got to do with health and well-being? But actually, the way that really sensitive issues, that it can affect somebody for the rest of their lives. Those who have actually had that suffering and gone through bereavement, the way that ends, it really can last a lifetime. So it's really, really important to get this right, and I'm really pleased to see it here. And it might be an idea, Paul, if we could have a link perhaps through to the other panels that are working, so that people can see what other work is going on underneath the JSNA, which doesn't sort of spring up as something they desperately want to read, but if you actually look at what it's trying to do, it's to actually address real life on the ground situations and problems. And that's what Natasha's sort of brought to us today. It isn't just something that we tick boxes on. We get involved and try and get things sorted. So if that's possible, Paul, just to remind us of how much is going on in that world of the JSNA. And then I'm going to ask Laura, who's got a hand up, and then Forbes.
Thank you, Chair. I just wanted to comment, slightly echoing Vivian and Teresa, really, but also doesn't this just kind of demonstrate the importance of it actually, it's up to us to get those systems behind what people see correct, because to the person who's experiencing that, and I've been in that situation myself, I have no idea what those systems are at the time. I mean, I had a, inverted commas, good experience, if you like, where all agencies work together, but actually it doesn't matter how that happens. To the person who's in that situation, it matters that it happens. And I think, you know, this has been so clear about saying, well, actually, it's up to us to get that structure right, and it's up to us to get all those lovely flow charts and all those that lovely partnership and information and all those things to the person. It just matters that it happens. And I think that's incredibly powerful. And I'd also echo Rebecca's sort of thoughts on it would be good to see more of this work coming forward, because I think what it does is gives us a really clear kind of picture of what all this stuff actually means. A lot of you in the room are massive sort of health and well-being and professionals, and some of us are laypersons elected to represent laypersons, and when you can actually say, look, here is this study, here is this work, this is what it means, that's actually very powerful as well, and very useful. So, you know, I would just echo that, and thank you. I think you're on mute, Rebecca.
You're on mute, Chair.
Oh, sorry, I was saying hello, Forbes. Are you there?
Yeah, I wondered. Okay, thank you. It's really just a comment about how we best use the learning from the JSNA. JSNA documents in the past are always very informative. I think this new approach is really welcome, and it's been fascinating to hear from you, Natasha. So the comment about let's hear from the other working groups or work streams, but actually it can't be a document that sits on the shelf. It should be informing our strategic system planning in Dorset, and sometimes it doesn't, or it's not given the platform that it should be given, because it's very real and very pertinent feedback from our service users or patients. So I think we need to keep it live and keep it in the right places to make sure it's given proper attention.
Absolutely, Forbes. And Sam, do you want to follow up?
Yeah, thanks. Very quickly, I think there's a couple of opportunities here. I'm not wishing to make any prescriptions, but obviously as the integrated care system develops, there's a number of work streams that are going to be taken forward. And I think it's for us to flag and raise the profile of some of the findings that come out of the JSNA. So there'll be a link through to the strategic commissioning work stream. But I think even outside of the ICS work streams, the more voice we can give to some of the powerful stories that come out of the JSNA process, as opposed to a static report, the better. So I'm sure we'll be having some conversations with our comms colleagues about the best way that we can start to build on some of the main messages coming out. So it's not just about a report. We should be doing a lot more than that. So thanks for the question, but it's a very apposite time to get some of this into our new way of thinking about service development and improving outcomes for people.
Yeah, absolutely, really, really good. So lots of actions out of that. I'm sure lots of it's happening already, but it's just so good to get that assurance that it is being actioned in various places and together. So thank you, Paul and Natasha, on that one. Is there anything else you'd like to add, or should we move on to the next item on the agenda? I think we'll move on. Thank you. So we've got Teresa, Richard, and Councillor Andrew Parry, who are going to take us through what I'd really like to see now, which is it's called the Children, Young People and Families Plan. I think that's an add-on from previous years. Really good to see that included as a group rather than just treating the child. It's important to treat their envelope of support. So I don't know how you're handling this. Welcome, Andrew. So over to you two.
Thank you, Chair. Just by way of introduction, grateful for you giving us time to bring our presentation to the committee this afternoon. You're quite right. Families are everything to our children, and we often don't talk about them enough in the round of things. So it's a great opportunity to rather formally acknowledge the importance of the family unit. But we also know that families can sometimes be imperfect, and delightfully wonky is how we'd like to describe them in some of our respects of our families, because they're fabulous in every way. I know Teresa will speak at great length and with absolute professionalism and certainty on the many ways that we hope to improve our services for our children and young people and their families, and the journey that we've been on. And my goodness me, it's been quite a journey in the last few years. But there's hopefully some sunny uplands to it. A little over a year ago, I sat quite ashen-faced as I realised that COVID was going to have some really significant impacts on our children and their vulnerabilities. In many respects, it's to the credit of them that so many have shown resilience, but we mustn't forget those who have been affected during the course of the last year. But as we go forward, I do so with great optimism, and I want to hand over to Teresa.
Thank you, Councillor Parry. Teresa Levy, Executive Director for Children's Services. But absolutely, this plan is around children, young people and their families, and describes a whole family, whole life approach to how we're going to, and we already are, in fact, working very closely with a whole range of partners to improve those life outcomes, understanding very well from lots of the needs analysis that's been undertaken around what those needs are. Crucially, I think in just picking up on the previous presentation, one of the great strengths really of how this plan came together was at the level of think tanks and partnership planning sessions and engagement with young people, that it was those young people's voices that really framed so many of the priorities within this plan. So we'd started off with 6 and we ended up with 1 more, because our young people said to us, not only, we agree with some of the 6 and shaped those very well, but they also told us that they wanted us to pay particular attention to making sure that Dorset's the best place to live. So the best start in life, absolutely, making sure that we're already wrapping around and improving the maternity services that we can provide for all of our new mums and dads and little babies. COVID-19 and the past year has been a real challenge for the very tiniest in our society. And we're seeing nationally an increase in the worst possible outcomes, those significant incidents in babies, of about 30% increase. And we've seen some of that locally. And we know the level of pressures around that time, the real importance of having the partnership really wrapping around, coming together to work with you at that time is absolutely critical. So we're paying particular attention to that, but also wanting to make sure that we work intensively with families where there are real complexities. And so sadly, it is true that we see too many mums and dads who have had babies removed from their care on more than one occasion, and those subsequent removals increasingly difficult and increasingly distressing for children and those carers. So we're looking at development of a pause programme to work with those families, and that's all within the best start in life. So you can see that each priority group, each work group, each activity base works across the whole population, looking at what's right for everybody, but also then drilling down into those very specialist need groups to make sure that we're also making the best start in life for all of our children. And it's the same for Young and Thriving, it's the same for good care provision. Really a huge amount of activity going on in the good care provision, taking us to a place where we have sufficient amount of good quality registered care for our children where they need it. Best education for all, very strongly framed from what our children and families have told us, which is that they want to have a really strong inclusion approach. My apologies for landing the aeroplanes just right now. I hope they're all off to those quarantine hotels, Sam, that's all I'm saying. They must be very full, those quarantine hotels, I can assure you, living where I do some of the week. That real strong inclusion. So what our children told us really clearly was that they wanted to be in Dorset, in school, with their families. And no news there, that's where we want them to be. That means everything we do, we have to really pay attention to that, and that's what matters. They also told us that they didn't want to have to transition through changing relationships too often or too soon. So really looking as part of that best education for all, the SEND offer that we have, and making sure that we don't transition children too early when they're not ready. Best place to live, lots of messages about that, some of it being physical activity issues, some of it being about being able to access the outdoors, being able to access beaches, particularly for children with disabilities. But actually just as much being about children saying, if I am different, if I perceive myself and the rest of the world perceives me as different, I don't always feel like I belong in Dorset. A really powerful message from LGBT communities, from Black and minority ethnic groups, and from children who experience themselves and guide the world experiences them as different, and wanting to have a greater welcome to that difference in Dorset. So a really strong message for us there in the best place to live. And clearly then coming to some of our own services and how we work as a partnership, delivering that locally, because that was again a very clear message, doing that locally and doing that with all of those other partners. So really re-energised local area groups at each one of our locality levels, delivering interventions into their areas, from working with voluntary sector all the way through. Again, looking at whole populations and looking at specific specialist groups as we need to all the time. So we're looking at celebrating what has been a very busy and full year, actually, with lots of achievements already. Hopefully, yet to be quite confirmed, but we're hoping to potentially have a conference on the 1st of July to really be able to pull colleagues together who've been working in these ways, and then looking to come back here with an annual report in September on the Strengthening Services Board and this Children, Young People and Families Plan, looking at that whole family, whole life, whole community approaches. That's absolutely what they told us is that matters for them. The planes will probably now stop and you can ask the questions.
Right, far away. Questions to Teresa. Thank you. Comments. I'll ask one. So compared to previous, Forbes, you've got your hand up. So you go first.
Okay, thank you. It's a comment, really. So first of all, yeah, I found this really interesting. Thank you, Teresa, and very good to see. I suppose my comment is, you know, we've got to make sure we're doing the best we can for our children and young people and families in Dorset, and we've got to reconcile the needs of our whole population. It's got to be the best place to live for everybody, and it's just how we as a system manage those competing priorities. And you know, I'm just putting it out there really, because as I read this, I thought, you know, we've got to get this right.
Thanks, Forbes, and that is the kernel and the nut of everything, really. We are absolutely committed to improving the outcomes for all of those children across all of those ways and all of those families and communities. But we also know a huge amount, don't we now, about where we've got particular need. So where we've built that locality offer, we have been able to distinguish and differentiate that, and that's really important. But it also means that at particular higher levels of need. So the other area where we've had a very specialist requirement in this last year has been around young people with really complex health needs around eating disorders or mental health issues. And, you know, that requires conspicuous care and attention as well. And of course, we're giving that as a partnership. But it does mean that one goes up from thinking about how do you offer emotional support and wellbeing across all schools to all children, to how do you deal with those very not such small numbers actually at the moment, but those very particular numbers of young people and doing that. I think the partnership's doing that really well, actually. I don't think we're not in any part in the conversation where we're saying we have to decide to do one thing or the other. We are clear we have got to do both. We have to do wide scale early intervention alongside a really conspicuous attention to specialist need. And I think that's working incredibly well actually across this plan. But yeah, it's a challenge, Paul. It's a challenge around keeping that resource focus apart from anything else.
I think you've got a question from Sam there.
Thanks, Rebecca. Offer of support, really. I really like the plan. We're thinking through our public health business plan at the moment, and we're also going to have a session later on this agenda around where we are with prevention. There's obviously huge overlaps between some of what we do and what you do children's services. But I guess it's that next level of detail, isn't it? Where are the opportunities for really starting to focus the right level of support and effort on some of those groups that do have higher needs? So look forward to continuing the discussions, and obviously Joe's on the Alliance, but if you need to pick up any of those issues with the public health team, more than happy to do that.
Yeah, thanks, Sam. I mean, not only Joe's not only on the Alliance, she's leading the Best Start in Life with Amanda. I mean, I think that's the other incredible thing about this programme, is that there's so much joint leadership going on. Every presentation we have comes to the board that's chaired by Councillor Wharf. It's a joint presentation, which is the strength of it, really, and that's what's so important. So yeah, no, great, but we do need to keep on that integration.
Thank you. And I think Sam's just reflected what I was going to ask, was what do you need from anyone else that you're not getting? Because this is all of us, the first start in life. I mean, the life starts there, and it's the most important thing, and it'll determine outcomes forever. So is there anything more you want from the Health and Wellbeing Board that you're not, or is it really a matter of shoring up and those relationships that you've made, obviously, with members of the board? But is there anything else, or where do they go to if there's suggestions coming from other services? I imagine direct to you and to Andrew, but yeah, open door.
Open door, totally open door. And I think that actually what I am looking forward to is when we can come through this stage, and you know, I'd like just to kind of reinforce what Andrew says, that all thanks to our children and young people for being so absolutely fabulous during this time, because they've been incredibly compliant. They've gone along with the rules, even though it's really challenging for young people to be told so much of what you can't do is a challenge. So they've been fabulous. But I think the other bit that I'm really looking forward to is coming out the other side and being able to together get some more control on the comms that we're giving to our communities, other than COVID comms, because actually one of the things that we've been identifying through some of these deep dive work tanks with our children, young people and families, and through some of the poor outcomes from COVID, is that there is I'll lightly call it public health, Sam, but I think I'm talking about that kind of whole community messaging. We know that we still have a challenge locally and nationally with co-sleeping deaths. Babies who die by co-sleeping. Now, it's not that people haven't done some communication, but actually we've learned a lot more during COVID time. We've learned about the association of domestic abuse with co-sleeping. Not really a surprise. If you're going to be worried about baby or yourself, you might take baby into bed in appropriate times. So some of the subtlety of what we need to communicate to our communities and talk with them about in terms of what will keep them safe, what will help, what will work things through better, I think is an opportunity that I'm looking forward to us being able to occupy some of that space when the COVID messaging gets out of the way a bit.
Okay. I also understand that there's quite a problem with antisocial behaviour in the county, and I think there's potentially a really good place for some comms on that, so that where that is, it starts somewhere, and it's trying to get some understanding and some early prevention. Just had a recent example where I am, where working with the police, we've hopefully got that sorted right at the start. Mm-hmm. And that comes down to a lot of that working with communities. And Chris, the parish and town council message is really, really needed at that level, so that there isn't just distrust and dislike of young people. It's actually trying to understand and assist. It's turning that behaviour around, isn't it? Both behaviour of those of us who experience it, but those who carry it out. And that's a really big comms piece to do. Well, thank you. That was really good. Andrew, do you want to add anything else?
I was just going to say, the more that we can do in terms of co-production between different partners, the better. It seems to be the message that I'm hearing loud and clear. And you look at the advancement and things like the Strategic Alliance for Children and Young People, and having, the great efforts we've all gone to ensure that, and don't take this badly, anybody who's not in the room, but the right people in the room to have those conversations, to be able to move the agendas forward. It's so important because there's a lot of commonality in things. And yes, our communities look at us and say, well, what are you going to do about those unruly children in that particular street or whatever else? But actually, we need to be saying to the communities themselves, well, what will you do to help those people? What's going on there? why are they there? Has anybody actually engaged with them and had those conversations? And that so matters. And you know, what we will then find is that we will unpick a host of other problems that go way back into that family household. You'll find, you know, and we'll be able to properly do some really good engagement with those families and those individuals. And so that's really the message I want to bring to the board today is, you know, if there is anything in the system that is being log jammed by politics, let's do the work to unblock it, because that's what we're here to do, is really help our communities and our, you know, our pledge to make our children and young people thrive.
Brilliant. Vivian.
Just building on the, you know, the sort of collaborative approaches, I think it's really powerful to see that we've got established, you know, firmly now in the plan around accommodation and housing, and how important that is. You know, I mean, we talk a lot about it, but to see it in the plan for our young people and our families, I think, you know, that's such an important investment, isn't it, in terms of, you know, what a good life can be like for our young people and families. You know, having the right home is definitely what really matters. So yeah, really good to see. And I think the work focusing now on, you know, what a ready and steady approach to moving from childhood into adulthood, and how we support people, you know, that's going to be a really powerful tool to make a difference to outcomes for our young people and for our families, and how they see us as well, and can intervene with us earlier at the right time. So really good, really powerful to see and hear.
Brilliant. Thank you very much. And please, I know, Andrew, you came along to the meeting. Please stay. We've got some really good items if you want to continue and listen, because the next one, again, this can really help young people, as it can all of us. We've got an update on physical activity strategy. Charlotte, I know, has come from I was at a physical activity workshop this morning. And so Charlotte's joining us to give us an update of that joint work between hopefully all of us, but very much led by her and colleagues at Active Dorset. So Charlotte, welcome.
Thanks, Chair. Afternoon, everyone. I've just got a couple of slides to just help talk through where we've got to. So hopefully you can see those, or they're coming. Give me a shout if not. So I wanted to just give you a little bit of an update on. We've worked quite closely with Public Health Dorset, Sam's team, so Natasha, who we heard, but also from Rupert, and we've followed the JSNA approach to this, and that's been really useful and really important as well when we're thinking about mapping the system and working together.
Charlotte, sorry, your slide, that's better. Brilliant.
Okay.
Yep.
Sorry, Teams is on a go slow today, so hopefully we'll move through the slides and it'll all be okay, but shout if they disappear at any point. So the first slide, I just wanted to touch base on why we felt it was important to take a whole system approach to physical activity. And really it was about making sure we had a core group of key actors with a common understanding about what drives inactivity, where are the gaps and what are the barriers for people to become active, and to have some clarity from doing this work about what are the opportunities and places, things that we can change, and where are the points of leverage in the system for us that we can work together to increase physical activity levels. Hopefully the slides are moving on. They appear stuck, but hopefully you're seeing the slides move on. So we're into phase 2 at the moment of the physical activity strategy, and we called that the discovery phase, and really that is about us consulting quite widely, and there have been 3 parts to that. So we've had an online conversation where we've widely consulted, and that was a deliberate act to have, rather than a closed survey, it's an open conversation. We've been running some focus groups with key different audiences who we need to reach and understand what their specific barriers are, because barriers will be different for everyone when we think about moving. And we've just completed the second of 2 workshops with a key group of stakeholders, and again moving to that virtual delivery where those JSNA workshops would have taken place in person with bits of paper and talking face to face. We've moved to online, so that's meant a slight change in a reduction in numbers of people we can engage, but worked quite well. So to take you through the online conversation, for those of you that may not have seen it, this is what it looks like. So we used a tool called Padlet. We've had over 120 interactions to date, and it is very much a conversation. People can comment, they can interact and answer the questions, and it posed 4 key questions to people, and I'll run through some of those questions in a moment and some of the themes we've had in responses.
Just so you know, Charlotte, it is stuck.
Okay.
But carry on, because you'll make
okay.
anyway.
You'll have the slides afterwards. I'll make sure they get sent out.
Just so you know.
Thank you. And that online conversation is live until the 31st of March, the end of this month, and we may extend it a little bit longer just to make sure that we're able to capture all the responses from everyone. And we had some themes from the discovery phase coming out of that. So some of that online conversation, but also from the 2 workshops that we've just completed. So some of the key themes from the first question we asked, and the first question was about what stops people living in BCP and Dorset from being more physically active. And some of those themes won't be a surprise to you. Particularly, they were around costs of being active, finding the time to be active, and a consideration about having specialist skills or knowledge that need to be to do a specific activity needed to be knowledgeable or skillful to carry it out. In question 2, we asked about the effects of inactivity and what people felt the biggest effects were for people who were inactive, and what the effects were for people who live in Dorset and BCP. There are a whole spectrum of effects listed, as you might be aware, so physical and mental health, but also the wider cost to the community of poor health, so the impact on our services, on our communities. Question 3, we asked people about if you belong to an organisation, or you are a service manager, or you have a role in your community, what do you currently do to encourage people to increase their physical activity or to move more? And here there was a real focus on structured activity, provision of opportunities, and there was a bit of a narrative coming through about encouraging people to be active. So some people had cited about encouraging their workforce to be active and encouraging people to move more. And finally, in question 4, we were asking people about what they felt were the biggest opportunities for them or for their service or organisation to do more to increase physical activity levels. And the themes here really were around harnessing around our built assets, but also our green and blue spaces and facilities we have, and also a current theme around making people more aware of the opportunities or the benefits of being active. So from the themes from Padlet, put together from the first workshop, we started to build on the barriers to physical activity that people understood, and I tried to identify what influences that behaviour, what's driving that. So we started to create a system map, and you can't see it, but it looked similar to one that Natasha showed earlier.
Charlie, do you want me
yes.
to try and show the version of the slides I've got?
If you can, Paul, that would be great. They haven't changed much since. Do you want me to stop sharing and you can try? Brilliant. Yeah, that's where we are. Thanks, Paul. Fantastic. So as you can see, we ended up with quite a large system map here, and it focused, there were 3 causal loops. So these were just the conversations we had in workshop 1. We haven't yet analysed all the responses and insight we gathered from workshop 2 earlier this morning. But the first loop was about an environment that inhibits active travel use, and that those conversations centred around the prioritization of cars and the lack of resources or environment that's suitable for active travel and people's confidence or ability to do that. There was a second quite a large loop around social norms that perpetuate physical activity, and there was some discussions there about families and role modelling and the impact of inactive parents lead to inactive children and the importance of social norms, but also around leadership and role modelling and what's important to people, and how we talk about physical activity impacts on whether people are likely to consider moving more. And the third loop was around a system under pressure, and so that was specifically in relation to physical and mental health, and the fact that we know that being inactive drives the development of non-communicable diseases and increase in pressure of NHS services and adult social care, and then there being more money pushed into the treatment of those and less funding and resource available for our prevention agenda, and so fewer opportunities for people to be active, whether that's structured or just our built environment. Next slide, please, Paul. So from that, we've worked on that map, and it will evolve. So we'll come back possibly at the next meeting, and we'll have a bigger map where there's other bits that were missing from that initial conversation. But one thing I wanted to highlight with you, it's coming through really strongly, and it came through in workshop 2, through the online conversation, but increasingly today in workshop 2, is about the importance of language and using a language that people can relate to and understand. Next slide, Paul. And here we're talking about trying to reframe physical activity. So typically we used to talk about sport and exercise and 5 times 30 and a focus on the physical benefits, or you know, you should be active because it's good for you. And actually what we need to shift to is just talking about moving and sitting less, and the language you use is really important because that makes a difference as to whether people we talk to think that that's achievable for them or not. Is that for someone like me? So getting off the bus a stop earlier, taking the stairs instead of the lift, taking a walk at lunchtime, and that shift from that structured prescription of maybe 5 times 30 to every minute counts. Small changes make a big difference, and increasingly I think it's even more apparent is the benefits of physical activity are not just about physical health, they're about mental health and mental well-being too, and that's a really important connection to make. Thanks, Paul. Next slide. So moving on, we're just about to enter sort of phase 3 of building the strategy, if you like, or our approach to tackling inactivity. So as I said, we'll be gathering the insight from workshops 1 and 2. There's a little bit more we need to do in reaching other stakeholders who haven't been able to be at those groups because of other pressures on their time at the moment. And we also need to carry out some focus groups, and I'd be really interested in engaging with trusted voices in some other groups that I've chatted to Paul about. So children and young people would be one, people living with long-term conditions another, so that we can understand their barriers to inactivity and what would help them to become more active. And then we'll be prioritising those opportunities and the actions, understanding where the points of leverage are in the system, and really working them with some of the key actors in the system, because physical activity is one of those complex problems in activity, like others we've talked about today, where it takes all of us. We all have a role to help encourage people to move more. And that's the end of the slide, but I'm happy to take any questions about either the process or some of that.
Thanks, Charlotte. And
okay.
I can recommend joining any of Charlotte's workshops, as I did this morning. It's really insightful, but what's really good also is, as sort of leaders in whichever area you are, you can actually resonate and say, I can unblock that. So there was a discussion this morning about bus stops and them being too close together, and there was a conversation about cycle routes not going anywhere, and all sorts of things, which you just think, hang on a minute, I know someone who might be able to do something about that. And it is about the wiggle, isn't it? You know, if you're standing in a queue, just move on the spot. But anyway, over to everybody. It's some fantastic work. There's a lot more to do, but it's really moving on. I can't see any hands up. Are there any? I can't see everybody, so no. I think oh, yeah, Andrew.
I just wanted to comment, if I may. I very much welcome the talk about the sort of moving more and less about talking sort of formalized exercise and that sort of thing, because that in itself can be quite intimidating to somebody if you haven't got the confidence and you're conscious about how your appearance may be at this moment in time. The notion of going to a gym full of strapping people lifting weights and running treadmills, it's really quite intimidating. But actually, when you then start having a conversation with someone about doing some gardening, walking to the bus stop, doing a cycle into town, going, you know, even things like if you do in the world of politics, leafleting around households and all the rest of it, which we're in the throes of doing, you suddenly realise that actually during your day you have the ability to do a lot of exercise in that sense without being aware of it. And I do encourage more of that sort of language and terminology. I think that'd be really positive.
Thanks, Andrew. Yes, I think that's going to be really important around our communications as some of the findings come out from completing the work, and then how do we implement it? What do we do? Because I hear, you know, we don't want it to sit on a dusty shelf. This isn't just a tick box exercise. We actually need tangible change to come from this. And I think, you know, making it relatable to people is really important, and people feeling that they can achieve it, they can move more in whatever way that works for them.
Vivian, hello.
Thank you. Charlotte, thank you, because I think this speaks very powerfully to some of the work that I think we're going to come on to in the prevention and early intervention slides around, you know, how, you know, it's a much easier and more palatable message, isn't it, that you are identifying now for I'm, you know, just thinking in my world for older people, you know, it's really powerful about just slight movements, and doing something differently can make such a big difference to your well-being. So, you know, how we integrate this into our jointly into our transformation and the work that we do in our communities with older people, and how we build on this is really important. Because, you know, the messages that you're clearly have showing people, and I think that's why the comms is going to be powerful, isn't it? About, you know, because we're all a bit intimidated, especially after a year of sitting in our homes and sitting in these boxes. You know, the lack of exercise is, well, I can only speak for myself, is palpable at the moment. So really good. I'd like to think about how in my particular world we bring this into how we work, particularly with older people, and developing more independent ways of living. So really welcome it, Charlotte, and I'd like to have further discussions with you about how we bring this together. So thank you.
Thanks, Vivian. Yeah, I'd really welcome that. And I think it is about that language, isn't it? Making it simple. There's something for everyone there. So we need to shift the narrative away from structured physical activity to something more simple.
John, I'm glad you want to have a word.
Thanks, Rebecca. I don't think we've got Councillor Jill Haynes on with the meeting this afternoon, but of course this fits extremely well with the work that she's been leading for us on the leisure review. Very much, you know, a difficult issue, but recognising that we have a pattern of in a sense council-based leisure service very much centre based, very much building focused, and there's a place for that, an important place for it. But actually to recognise that many of the assets we have to promote physical activity and well-being in every sense of the word actually can come in other ways as well, particularly the offer that we make through our open spaces. And we know, and again, I think COVID's been a helpful opportunity to see just how helpful when people haven't been able to use indoor leisure centres and leisure facilities, how the outdoor assets that are there all year round, day in, day out, longer hours, of course, often we can run physical buildings and provide that source of recreational amenity for people, which of course is what they're there to do. So again, I think this piece of work is very helpful and very timely in the context of the thinking that Jill is doing with us and with other members and other partners around what the council's future role in leisure provision is and how we can make best use of all the resources we've got. And if I'm candid, potentially kind of slightly tilt the offer perhaps rather more towards the outdoor spaces facilities at a time that obviously the cost pressures that are associated with running indoor facilities is quite challenging. So I found it a very helpful and stimulating presentation, and a helpful reminder actually of the direction of travel we're trying to go. It is around leisure, exercise, activity for all, and say for me the open spaces are a particularly good manifestation of that because they are very much universal spaces.
And I think I'm right in saying, because I'm sure I've checked this with Jill and with Charlotte, that Charlotte's Active Dorset team are very heavily involved with the work that I know Jill is doing, wearing her community hat, and is involved lots of that. So there is a link there, which is good. Yeah. And I'd like to, am I allowed, Charlotte? This morning there was somebody's talking about messaging, and somebody very, I think it might have been you, Charlotte, who said we've been really good at putting up safe distance signs all over towns and villages. And then I thought, well, why don't we just add and wiggle a bit whilst you're on reading this site. We can use these message boards for other things, public health messages that are very subtle, as well as putting up the social distancing. It's just small stuff, isn't it? Wiggle in Wessex, thanks. Right, brilliant. I think everyone is very enthusiastic about moving more, and it is about that. Really good, and it's really important to have it measured. We've got to capture this so that we can prove the outcome. But that's for those who are cleverer than me, how you do that. Great, thank you very much, Charlotte. You've had a long day.
Thanks all.
So, maybe share those slides via Fiona or me or Paul.
Yes. Yeah, will do.
I'd love to show them maybe to Chris's audience at one of their sessions. Right, we're now going to move on to something which is very, very related. I hope Maria's here. Have we got Maria? Yes. Welcome, yes, Maria. This is really timely as well. It's fantastic. Maria's from the Local Nature Partnership, and she's got a really, really good title that Paul gave her actually, which is Recovering from COVID Through Nature. Brilliant. So over to you. You've got about, is it about 10 minutes or so? Is that all right, Maria?
Yeah, it's 10 or 15, so I'll try and be as brief as I can. I was a bit concerned that John was going to steal all my thunder. He nicely segued me in, so that's fantastic. So yes, my title today, hopefully you can see my screen, is Recovering from COVID Through Nature. Hopefully it's going to show it in presenter view momentarily. Or not. There we go. Brilliant. So, oh, no, it's gone again. Is that showing through presenter view?
Yes, at the moment. Yeah.
Fab. So the Local Nature Partnership, for those who don't know, and apologies for repeating for those who do, we were set up in 2013 and working with the health and wellbeing boards and the local enterprise partnerships, we work basically on the sustainability stall of the social, environmental and economic well-being of an area. So we very much work to maximise the benefits of the natural environment, but for people, for wildlife and for the economy. And to say we've been working since 2013. We've got 6 strategic priorities. Natural capital, so looking after our natural assets and our landscape and our wildlife. Natural value, so really looking at the economic value and other values of those natural assets. Natural health, which is obviously the main reason I'm talking to you today. Natural resilience, so looking at climate change, natural flood management. Next one is natural, oh, mine's gone completely blank. The last one is natural influence, which takes all of the others, but there's one about natural understanding. That's the one, sorry. Natural understanding, which is kind of the blue planet effect. The more people understand about the value of nature, the more people are likely to get involved in it. And then I say natural influence is taking all of the above and working with people such as yourselves, the local enterprise partnerships, on a wide range of things to influence and ensure that nature is embedded within our society. I just wanted to highlight a bit about some evidence. There you go. So Exeter University, their Centre for European Centre for Environment and Human Health have done a lot of research on this, and they highlighted that green exercise can bring in 2.2 billion in health benefits. So those costs don't have to then be spent by the health system. They've also looked at a threshold of 120 minutes in nature, and this very much links into what Charlie was saying. We really can help that move more by being in the natural environment and supporting both physical and mental well-being. And then Leeds Beckett University did a bit of research on the social return of investment. So they highlighted that, for example, a standard conservation work party volunteering activity, for every £1 invested, it gave a social return on investment of about £8.50. And then for more targeted people with low well-being, on a targeted intervention programme, for every £1, it gave about £6.88. I just wanted to put a little bit into context. So the loneliness strategy coming out in 2018, Lord Gardner highlighted that green spaces are vital for our well-being, and getting together outdoors can offer opportunities to create and nurture friendships. And I think, as John said, the pandemic has really highlighted this and encouraged more people, I think, have been getting out in the natural environment, particularly when we've not been able to meet friends and family inside. And then the environment, 25-year environment plan, again published in 2018, really highlighted how nature and natural spaces can improve our health and well-being, particularly for mental health, but does also physical health. And I've certainly been working with Public Health Dorset, the CCG and Active Dorset and Dorset A1B to submit a bid to be one of the pilots for the green prescribing service. Unfortunately, we weren't successful. Bristol, I think, was the only one within the southwest area, but we can certainly learn from them. Encouraging children to be closer, hugely important, and a lot of work is being done on that through forest schools, for example. And then greening our towns and cities, hugely valuable, as we've kind of highlighted, and also supporting for those green spaces once they're in place. And the LNP has recently responded to the Dorset local plan consultation to really support and strengthen access for nature and green spaces to make sure they're included. The Advancing Health consultation document really again highlighted that it needed to embed nature-based interventions, and it's really exciting to see that the Improving Access to Green Space review last year included Stepping into Nature, the Dorset Area of Outstanding Natural Beauty programme, leading for nature-based wellbeing aimed at older people and those living with dementia and their carers. And obviously, as you obviously know, healthy places is one of the key aspects of the ICS and the STP. So going kind of specifically onto the topic, I think somebody said it in the chat, there is a lower risk from COVID from being outdoors. So it's definitely a way that we can help move through this. For those of you who don't know, Natural Choices is something that is facilitated by the local nature partnership and aims to bring together lots of nature-based wellbeing opportunities and activities to make it easier for people to find out where or what's available, but trying to bring it together so that if somebody lives in East Dorset and's got family in Weymouth and Portland, they can say, well, I want to do this natural choices activities, and then they can start looking out for them themselves. So it includes conservation volunteering, it includes park yoga and walking for health. Obviously, a lot of those activities, or most of those activities, have been put on hold throughout last year and this year in the lockdowns. But they are starting to start up again. And so the roadmap to recovery, providing we still can do that from Monday, the rule of 6 will mean that a lot of activities will start to be able to start again. And by nature of them being outdoors, social distancing makes it a lot easier to be able to be social distance. Hopefully from the 17th of May, we'll be able to have gatherings for up to 30, and the majority of natural choices activities aren't that large of a get together. So we're expecting the majority of those activities to resume from them. And we're just in the process of checking with the activity providers when they're likely to start. But not all activities will start. There are some organisations who will be taking a more cautious approach and will be starting hopefully from the restrictions lifting from the 21st of June. I just wanted to take us back to pre-COVID times to mention Picnic in the Park. So back in 2018, Dorset LMP was working with Active Dorset, Dorset AOMB and Dorchester Town Council, and we wanted to put on a health and wellbeing event outdoors aimed at sort of getting people outdoors and to promote health and wellbeing, but we didn't want to promote that health and wellbeing aspect because we thought people might not come, and linking back to the language that Charlie was talking about earlier. So we decided to put on Picnic in the Park. So this had a number of taster sessions, park yoga, mindfulness in nature. It had music and it had a wide range of stalls that people could find out information, as well as health MOTs with Live Well Dorset. And in 2019, we were able to roll this out to, we had another one in Dorchester, we had one in Blandford, in Wimborne, one in Bournemouth, one in Weymouth and one in Swanage. And we had lots of plans to then run things in 2020, and obviously they were all put on hold. However, Dorset AOMB have been working really hard, and earlier this year have moved Picnic on the Parks online. So there's a web link there. And you can click on those different aspects of the map and you'll find lots of different activities. So for example, in the Creativity River, there are some Let's Go Wildcrafts that Moores Valley are running, and there's also sort of creative writing and some online activities. So these are for a lot of the activity, or the current activities on there are for things for now. So while we're still within the lockdown, it might be things that you can do with your, inspire you to do with your friends or support bubble outside, or it might be watching wildlife video cams, webcams, or as I say, there might be watching or poetry, for example. And hopefully that can help build confidence to people potentially who are shielding or who have been shielding, or people, as we say, who might not have been out much over the last year. And it will also give opportunities for things post-lockdown. So we'll be promoting natural choices and stepping into nature activities on there, and inspiring opportunities and places to go once we can get back outside with more friends and family. And these activities are really going to change with the seasons. And then the last thing I wanted to mention was HAND, Health and Nature Dorset. We held a workshop back in October-November 2019. And the aim is we want to develop a collaboration to really embed nature-based wellbeing. So we're working with you, working with the environment sector, and also with businesses to work with wellbeing leads and HR managers to support staff wellbeing. And the aim is to develop a common agenda, improve communication, linked to that language that Charlie was talking about earlier on. And it's to include the formal interventions, so the activities under natural choices and stepping into nature, but also those informal activities of just getting out in nature, moving more, as we've talked about, but also about potentially being a place for calm and reflection to support mental well-being. So again, finding the right language to encourage people to get out in nature to support well-being. And we want to do some research to find out what the barriers are. And we've got some assumptions. Is it because the nature-based activities, for example, are just in the wrong place by nature of them being nature-based. They might not be accessible if you don't have a car. Or is it because we haven't managed to get the right information to social prescribers yet? So we really want to improve communication. We're looking to put in a funding bid to help support this later in the year, and we're hoping to have a workshop in May. And it's really encouraging. We included HAND as part of the Local Nature Partnership submission to the Local Enterprise Partnerships, big ideas for their investment prospectus, and it is being included within that. So there's recognition of the benefits of staff wellbeing and productivity. So within that, we kind of, within HAND, we want to potentially support providers through mental health first aid training, dementia friends, develop some sort of common evaluation framework. So Public Health Dorset have worked very closely with Stepping into Nature to develop a framework which we hope can be adapted to have a common framework across the area, so we're all meeting and evaluating on the same themes. And then, as I say, potentially some specific projects, so potentially working with younger people and also supporting BAME communities potentially to give the confidence to get out in the natural environment. So in conclusion, I just want to say the natural environment offers huge benefits of physical and mental well-being and moving more, and offers huge opportunities both during the pandemic and beyond. So I look forward to working with you in the future. Thank you very much, and happy to answer any questions.
Thanks, Maria. That's really good and really timely. So I'm actually going to ask, is John here? John Selgren?
Yes, I am. Yeah.
Do you want to add anything? Because I know that you've been working, your team particularly been working with Maria and the LNP for some time now, and it seems that it's come to some real live things on the ground. But what do you need? What's the ask, Maria? And John might be able to help, or we might all be able to help.
Do you want me to say what the ask is? I mean, I think, as John rightly said, the environment is cheaper to run than a building, potentially, but it's not free. So the interventions still need investing in, and there's only so much we can do as we are, and the environments themselves need investing in as well, because there is evidence that higher biodiverse areas are more beneficial to our well-being, and linked to what Chris Skelly was working on with the microbiomes. Again, that more biodiversity rich supports the microbiome. So support working with you, and any investment opportunities would be fantastic.
John, do you want to say anything before I bring in Forbes and then Teresa?
Do you want to take Forbes and Teresa first, and perhaps come at the end? That's probably
no worry. Forbes, then Teresa.
Okay, thank you, and thanks, Maria. That's very interesting. I just wanted to check. You've listed a series of really important relationships in your last slide there. You've mentioned primary care and the CCG. I just wanted to check that you're as actively linked as you might be with the work that's going on within practices and primary care networks, particularly with regard to social prescribers and health champions?
Yes and no. I say yes, as in they're on our radar, and I've got some direct links into some of the areas. I know a colleague who was at Live Well Dorset has just joined PCN, so I've got some links in there. But it is capacity. I mean, I say we're looking to get some funding for HAND to help coordinate. The Local Nature Partnership, as I said, has got 6 strategic priorities. I spend more time to working on the health and wellbeing one than I possibly should, if you say it's more than a sixth of my time, because I really see the value of linking in. So we've got some links, but the capacity side does mean that we don't have as many links, but we're hoping that HAND will help with that. So they're on our radar, but we probably don't have the direct links.
Is that something you could help with, Forbes?
Yeah, it is. I mean, probably a conversation outside of this. Very happy to pick that up, and because there is an open door here, and there's particularly if hopefully we move beyond restrictions, then we will be really actively pushing this type of thing. So, you know, it would absolutely go hand in glove, really.
Right. Thank you. Teresa, you had your hand up.
Thanks, Chair. So I'll also be in touch, Forbes, about possibilities around some social prescribing opportunities at St Mary's, Shaftesbury, which we're just looking through. So that would be really opportune for us, I think. But I could just, I mean, Maria, thank you so much, because it was a really helpful conversation, these last two presentations. I'm now standing at my stand-up desk, which I was sitting at, so well done, nudge works. Forgot that I was sitting at a stand-up desk, because it's one of those kind of fluctuating ones, so lots of messages for us there in the workplace, which is good. But my big issue, I have to be honest, is about the way in which we see girls and boys change in their physical activity over the years. And it's not just about girls falling out of formalised sport, but the way in which girls use their bodies even in playgrounds changes at the age of 8, 9, 10. And some of that's about, you know, what we push in those playgrounds. Some of that's about the messaging. Some of that's about clothing. Some of that's about how we encourage them to keep doing activities. So I'm kind of back to my public health messaging and really thinking in everything that we're putting together. So again, it's a kind of message for our towns and parishes too. If we're putting together playground equipment, you know, who is it we're talking with about how that might be used? Because that's absolutely key, really, in terms of how young people use that. So if you go around the skate parks, I'm afraid there's not a demographic that's equal and balanced. And we have a really significant issue, I think, around how girls and boys keep engaged in physical activity.
Really good point, that one. Really good point. Thank you, Teresa. John.
Thanks, Rebecca. Just on those 2 points, really. So quite rightly, as Maria said, nature doesn't look after itself. I mean, it will do at one level, but actually to really make use of it in the way we've been discussing this afternoon, Maria's quite right. The investment we make in that, both we and all kinds of other organisations, and we're very fortunate actually in having the local nature partnership that just helps us keep all that cohered together. So again, you know, Maria and her colleagues, you know, also part of that resource, but it does require funding to keep it rolling along. The other one I did want to pick up was actually Teresa's point, because I think the other real challenge for us as a group, and I think, you know, we look at things like the JSNA and so on, it's that real challenge to make sure that these facilities are being made available, and we're encouraging those who are perhaps, in a sense, not geographically, but furthest from them, those hard to reach groups, those most in need groups. As we know, you know, this tends to perhaps favour a particular demographic, or a particular demographic that will tend to use these facilities. I think that the challenge to us as a board is really to make sure that we are doing as much as we possibly can to encourage those people who need these facilities most to take them up. So, you know, all those things, walking groups. Teresa makes the point about young people in particular may become disengaged, disenfranchised, people who don't have access to their own transport, don't have their own car, for example. And certainly if Brian were on the call as the council's portfolio holder for transport, I know would be raising that point that, you know, accessibility by public transport is important. Indeed, walking or cycling to those facilities as well is another option. So I think we just need to make sure we're keeping that challenge, keeping sighted on that challenge of looking at those metrics about, are we really making sure that everybody that we, particularly those that we really want to target with these facilities, are really taking them up, and what can we do to in a sense break down the barriers that may be preventing them from doing that?
If I can just follow on to that, I mean, some of the work that we're hoping to do with HAND, as I say, is to test some assumptions and to find out what those barriers are. I mean, I know Stepping into Nature, for example, did a bit of asking why people were at the beginning, why people weren't attending their Stepping into Nature activities, and they said it was transport. They put transport on, didn't make any difference. So they're now looking to see about nature buddies. Is it that somebody needs a bit of support? Because they might be living on their own, or people that they live with aren't interested, so they want somebody to go along with them to test those things out. So yeah, absolutely, we want to sort of work with that, and we've already had discussions with Dorset Race Equality Council, who are very keen to work with us to support their communities, because traditionally the AIM communities aren't get engaging because they don't necessarily feel welcome. Maybe, and so we are working. So yeah, absolutely agree with that.
Thanks, Maria. It's so good to know that you've tested some of these things about transport, etc., and that's a really good point. Laura, you're next.
Thanks, Rebecca. Yeah, I just really wanted to touch on, Chris has put a point in the chat bar saying, can we do more to get young people to join scouts or youth clubs or sports clubs, and perhaps touching on vouchers and things like that. I think that's a really good point. And you know, as the parent of primary and step parent of primary school age children, I know that they do quite often come home with flyers in bags and you know, things like that. But again, that means that parents have got to take them, sometimes pay for them, sometimes have the right kit. Now that's okay for me. That's not okay for everybody. They, you know, may not be able to afford to do that. The other point that I wanted to raise, and it leads back to the work that we've been doing alongside our colleagues in the voluntary sector, is actually on this. A large, I think, quite a big barrier to more physical activity, in particular things like scouts and local sports clubs, is actually having the adult volunteers to run them. I know lots of kids waiting to join scouts, parents getting really grumpy. You know, my son wants to join scouts, and you kind of think, yeah, but where are all these volunteers coming from? And I know that the Volunteer Centre Dorset have been doing a huge amount of work over the pandemic with volunteers, and I just wonder, going forward, we're talking about how we convert some of this wonderful energy from our communities around, you know, we have more volunteers than we knew what to do with at one point. You know, people were like, I'm absolutely desperate to volunteer at a vaccine clinic and I can't get a slot. Or, you know, I want to deliver shopping, but there's nobody needs it. And I wonder if there's a piece of work that we can do, or it maybe is already happening, around channeling some of that really good stuff. And of course, people will be going back to work, but actually scouts or a football club or something like that is something you can do outside work. And of course, then really has a huge physical impact on the adult that's running that. So I just wonder if there's a link. After all, the Health and Wellbeing Board's supposed to be all about links, making stuff happen. And I just wonder if there's a link in with our volunteer centre colleagues around harnessing some of that really good stuff about people wanting to volunteer and channeling it into this sphere from the food delivery vaccine hub kind of world. So I just wanted to make that point.
That's a really good point, actually, Laura. I mean, you're quite right. There were loads of volunteers. Lots of people wanting to do things, and no, they know they won't always want to go. They won't be going back to work. Not a lot of people, and we've sort of thought about. There's a lot of talent as well in Dorset, which is untapped. Those who retire to Dorset, but they're actually not pensioners. We've got a huge amount to do there. I thank you for reminding everyone about that. And we need a place there. Maybe that's something for Chris and Dorset Council to pick up on. That's really important, and also that builds in with John and Maria and the volunteers who help in the local nature partnerships. There's tons of opportunity there, isn't there? I don't think there's any limit on how many people you need to volunteer to help in the countryside. Would that be right?
Absolutely, and I think it's an equal point to the environment. Volunteers also need support, and I think in the past, through social prescribing, there isn't necessarily the funding then to also support the volunteers and the people who need to support the volunteers with that. So, you know, absolutely, we can certainly do more, but we also need to support those volunteers through paid roles to do that. But no, absolutely.
John?
Maria's covered it, the same point, thanks.
Okay, lovely. Maria, thank you very, very much for coming along to this. It sometimes, I know meeting physically is good, but actually I doubt we would have had you along so speedily as we did, because I think we only talked about this before Christmas, and here you are, so that's brilliant. And I hope that you still plug into the Health and Wellbeing Board, and if you need anything, you just ask anyone who you can see on the board, because it's a key part of prevention, and that's what we're all about. So thank you very much.
Your time.
No, it's really good, and we've got a bit. This is a last bit, which was really to try and sum up where we are as board members as well. So I asked you to provide a couple of slides of everybody's, the membership of the board's prevention. And I was delighted by the response, and I appreciate that not everybody has put everything on, because some have got a load more, and even as you're writing them, it becomes bigger. I'm going to try and attempt to share the slides. I've got Sam as a backup just in case it doesn't work for me. And as I go through the slides, Sam is going to, so I don't think we've really got time to run through all of them and speak to all of them. If we can, then that'd be great. But I just want to, does that work? Is that working?
Not seeing them just yet.
Yep.
So, no. Right. Okay. Sam, do you want to? I'll try and try and get them to share. But if would you mind doing some narrative about this one?
Yeah. Thanks, Rebecca. I'll sort of kick us off if you like. And I don't have a copy of the slides, so I can't share them. It looks like they might be coming up now. That's looking more promising.
Yeah.
So I just wanted to sort of recap on this concept of prevention. It's a tricky concept, isn't it? It sounds great, and we all talk about it a lot, but it's notoriously hard to prove that something hasn't happened as a result of an intervention or a project. But as Rebecca said, this session is really all about taking stock of our current prevention work, recognising that a lot of the work was necessarily paused because of the impact of COVID. But we felt it's important to start a discussion today in the board to understand where we really want to put our efforts and focus going forwards. And I'd also add to that list to consider where we might want to invest. So the slides were requests to organisations in the Health and Wellbeing Board, just to put down a couple of points from an organisation's perspective of where we felt some of the current effort was happening. And I was just going to take the Health and Wellbeing Board back to the prevention at scale work that was started as part of the Sustainability and Transformation Plan around 3 years ago now. And at the time, the public health team agreed to lead that portfolio of work in the shadow integrated care system, as it was. And we spent a lot of time trying to tease out what we thought might make sense from a programme point of view. For those of you who remember, we had a joint Health and Wellbeing Board conference with the Bournemouth and Poole Health and Wellbeing Board to launch the programme. But when we lifted the curtain on the concept, I think what occurred to me was just how difficult it was to put all of the aspirations, the ambitions around prevention work into a structure that would make sense from a programme point of view and engage and inspire organisations and the people that work for them to understand how they can make a difference. So we eventually lighted on a structure of starting well, living well, ageing well, and healthy places, just to think about how we could give a bit more visibility to the programmes and projects that would be owned by partners across the system. And the overall aim was to improve healthy life expectancy in Dorset. And you'll have seen some of the metrics in the strategy that was presented earlier today. The Joint Public Health Board agreed to support the Prevention at Scale programme with non-recurrent investment. And this was largely from savings that the public health team had made from the main public health grant. As we've retendered various services, sometimes we do have non-recurrent investment that we can put towards this type of programme. But we always made the point that we were never going to be able to commission our way out of this challenge. And actually, the investment was much more about capitalising change in the wider system. So we invested in a number of projects that would make it easier for people and organisations to support more people to lead a healthier life, not necessarily put the money directly into interventions. So we're now at a point where the STP is being replaced by a legal integrated care system over the next year. We need to continue with the work that was started under the previous plan, the STP, And so the session today is a bit of a stock take across organisations represented on the board, just to look at the current work that's going on around prevention, but also to start the conversation. So that was my preamble. Any luck with the slides?
Oh, I thought that they were working because I was flicking through. Obviously, I'm not very good at this. So I had thought that I was flicking through them as you were speaking, Sam. So what I will do, that's really sad because there's a lot of work has gone into that. But they will come through, and everyone has contributed. Really, really good. And I think what we need to do is actually, I wonder if this will work, is from a point of view of the board is to actually drill into what we think where prevention is now, and what everyone's view of prevention is, because I think that some people have got a very different take on prevention than others around the table. So let's look at that and get into it and maybe have that discussion, because language, I think, as other people were saying in other presentations, it is really, really important. I'm going to try one more go. This was it. I'm not having any luck, am I? No. So where am I? Yeah?
There we go. Brilliant.
Right. Okay. Wow. So quickly then, because are those in big?
Yeah, it's in presenter mode.
Okay. So we've got Dorset Community Action. Really good notes of what's going on there. CCG. Again, there's a lot happening, huge amount happening, and just the way that some of these headline figures are being presented again shows how differently all of our organisations, that's the fire service, look at things and set them. So some have been given to us in terms of data and stats. Some are a narrative of what's happening. Some are strategies, or they are ambitions. I'm sure everyone does measure the outcome of their prevention activity, but as a board, we probably need to capture what it's all achieving. But also, as a board, all this work that us as members are carrying on and can link up, but also feed into the ICS that Sam was talking about, because this is a really, really big pillar of what the integrated social care system needs to achieve on the ground. So I'm really grateful for everybody's input, and I think these can really, really help all of us and those partners who we heard from today about what we need to do next and looking at this. And I would almost go as far as, and I haven't talked to Matt Prosser about this, but I think we need somebody who is actually joining up and just coordinating, not repeating everything that everyone is doing, but actually taking account of what it is, so that it forms a narrative and also is outcome based. So Sam, I don't know whether you want to add, now having seen these now, but as you can see, there's a lot there, and we need to get the value out of it.
There's a huge amount, isn't there? And I think the only thing that I'd say is that it felt like we came to a sort of natural pause in the Prevention at Scale programme. It was very much about raising awareness of what might be possible. As I've said, it was about trying to develop broader ownership around the issue through organisations and the people that work for them. I think the challenge I'd throw at us all as a system comes back to a couple of things that have been mentioned in the meeting today under different agenda items. In Charlie's presentation, I may be paraphrasing, but Charlie made the point that we often seem to be spending more and more on the consequences of treating chronic disease, and don't make that link naturally with investment in some of the things that might keep people well. It's not an easy thing to do, and this is something that I think we've struggled with for a long time. One of the things I've been thinking about recently is falls prevention, and if you look at the difference between the number of people that we treat with fractured neck of femurs in the local system, it's huge. And that's not to say that those people don't need those operations at that point. They absolutely do. But we don't give enough attention to what's happened in the run-up to someone requiring a hip replacement because they've got a broken hip. So I think it does, the challenge is to start to think through how we can really think about that word investment. We can't just sort of support the Prevention at Scale programme through non-recurrent, relatively small scale support. If we're going to be serious as a system about starting to work more upstream, then we've got to be really, really clear about the evidence base. We've got to be clear about the outcomes. We need to understand the effectiveness of some of that intervention. But equally, we need to have a better go at understanding how to unlock some of the value that's currently invested in our system and shift it upstream. And that's difficult because many of us work for organisations that have to look at this on a year-to-year basis, but it doesn't mean that we shouldn't do the right thing.
Thanks, Sam. That was a really, really good, helpful steer. I've got a Forbes, then Laura.
Okay, yeah, thank you, Rebecca. First of all, I was glad to get sight of the slides, even though it was short. But when I quickly see them, and first of all, can I have a copy of the slides?
Yeah.
And secondly, I suspect there's nobody in Dorset knows all these bits of work that are going on at organisational level. And really, just to support Sam's comments, there's a real opportunity here. One, because of what we've just come through and taking stock, and secondly, because of the development of the ICS. And just to support really all that's been said in this meeting this afternoon, the relationships in this meeting are critical to driving this agenda forward, because you've got the right people with the right connections here. And if you think about the proposed ICS structure, not only do you have a board, you have a health and care partnership. And that's where we need to be making the most of trying to develop an effective prevention programme.
Thanks, Wilson. Yes, of course, the slides will come through, and I apologise for my technical issue. But the evidence, I think, is there, and as you said, it's a really good start, and we need to push it out and up, as Sam said. Laura.
Thank you, Rebecca. Yeah, I think one of the things that we'd like to do in adults at Dorset Council is, what our colleagues in children's have done this time, and kind of have a look at a bit deeper in what we're doing on this. And certainly, I've had conversations just this week with officers and with colleagues as well around, okay, all of the work that we do, all of the transformation work that we do in our directorate, it's really important. But actually, you mentioned the example of somebody breaking their hip or breaking something. We need to be outcome focused, and what that means is if somebody needs a really simple piece of OT equipment, we need to get it to them very, very quickly. Without that kind of, let's have a massive assessment, let's go through this huge process, let's talk about what your long-term needs are. Actually, if somebody needs a bed rail to stop them falling over, then that is our job. That is what social care and OT should be doing. And so for me, a lot of this is really about, do all partners around the table understand and have the same sort of understanding of what place-based means? When we refer to place-based stuff, are we all talking about the same place? So when our GPs refer to place-based, are they referring to the same community that, you know, that a patient would recognise, that a social worker would recognise, that an OT would recognise, that someone from the fire service would recognise? You know, all these different places. And do we need to be sort of framing what we mean by place-based, you know, collectively, so we all mean the same thing? Because otherwise we're talking about different places. And I think sometimes, you know, perhaps our colleagues in the NHS have a slightly different interpretation, not wrong, but different interpretation of what place-based means. And so I would hate to think that we would be working at cross purposes on that, because for me, we start with the outcomes, and it, you know, in a lot of cases, it could be something uber simple that saves the acutes lots of money on a hip replacement.
Yep. Like carpet, tripping over carpets.
I hate carpets anyway, so well, yeah, get rid of all carpets. But yeah, exactly.
You're absolutely right.
Things really small things, we mustn't forget them, and we must all have a shared understanding of what they are and where they happen, and what our people are doing in each of those places, and how we join them.
Brilliant. Yeah. Vivian.
Yeah, I think I was just about to say what Laura had said, but what is interesting on the slides as they quickly go past, and is that there are so many similarities about, you know, what people are looking at and thinking about, and you know, the join up, you can begin to see really clearly, can't you, about if we all understand what place is and what the outcome is that we're trying to achieve. You know, there's some really good work that we could do in a much more joined up way. So it's very powerful, I think, to see some of these bullets really pick up those things that we can do together, as long as we understand what that actually means in terms of what outcomes we're actually looking for, and then that collective approach to delivering on, you know, be it for the person that could have a better life at home in a safer environment, to prevent a more acute activity happening, and they end up in hospital and needing surgery, etc. You know, some of these things are just powerful, that we're seeing just before us. So I think it's about how do we as a board bring some of this together and start seeing sort of different outcomes for people, you know, and how are we going to prioritize some of the many priorities for each partner.
Yeah, absolutely. Thank you, Vivian. Tony Meadows.
Thank you. I suppose, having worked around, as many of us have, the sort of the prevention agenda for many years, you know, you can talk about place, and I totally agree with what Laura said on that. But again, sometimes it is a huge thing to sort of try and tackle with because of the diversity. But I suppose one of the key things we've got at the moment is, I suppose, I'm suggesting, is an opportunity. If we look at the problems that we've been through over the past year, if we look at the impact that has had on, for example, elective procedures, and the fact that obviously significant delays, that's going to have an impact on a lot of people, particularly older people, and increases the risk of falls. Now, if we think about it both from a prevention at scale and a more targeted sort of prevention element, it's almost like if we were to take that strand of activity and look at it, well, okay, how do we prevent at scale in terms of equipment? But how do you actually look at promoting physical fitness to actually make people more able? And then what are the next stages of prevention that you could be looking from that point of view? It just seems that there's an opportunity there which might be a really worthwhile piece of focus, because we are going to a certain degree, have a significant pressure point, especially as we drip in and out of sort of phases of COVID, etc., and how that impacts on surges in the system, where maybe that's something we should be considering.
Thanks, Tony, and thank you, everybody. It sounds like maybe we need to have a real session on this, without sounding like another sort of development board, but a really understanding of what we all mean, because we've all got something here that is prevention, and how's it all going together. But maybe that's a conversation perhaps with Sam and Forbes. Would that be right? And Vivian, Teresa, Sam, what do you think?
Well, I'm on the spot now to solve it.
You don't have to decide now.
I think it's,
yeah.
I think, as I said, it feels like it's a natural pause at the moment where we probably need to think about, is the right thing to maybe target some effort into a few spaces where we really want to make a difference on some outcomes that haven't shifted. I guess when I look at that huge range of efforts that's going across organisations, to some extent, that's a success, because we've managed to galvanise interest in prevention work through the organisations that were connected to the STP. We obviously need to keep that going, but I think there's something for us as leaders as saying, what is it that we're collectively going to identify and sign up to? What do we really want to shift? And are we clear about how we would do that and the resources that we'd bring to that? So I think that's the next iteration of this discussion, but that's just my view, really. There are some opportunities, I think, as Tony's highlighted, ways of thinking through what those opportunities mean and how we work differently, but also, new opportunities in the way that we're starting to work together as a system. So I think let's not let it slide is my sense. There's a lot of good energy that's come out of the challenge we've just had. Let's see if we can put our heads together and really identify where we want to put our shoulder to the wheel.
Okay, well, look for next steps. But I do really thank you all for coming up with those bullets so quickly. And it just, that exercise in itself has illustrated quite a lot, and that's really helpful. So that's the end of the main items. Those slides will come through, and I'll send them around at ASAP, so it's still fresh in your minds. The next item on the agenda was urgent items. I don't believe we do have any urgent items today.
No urgent items.
If anyone does want to raise an item for any future business, I'm very happy to have a listen or send me an email. But I think this one's going to be quite standard. And then there's exempt business, and there is no exempt business. So thanks everybody, and thank you to everybody who came along as guests and contributors. And please come again, because I think sharing all this information is so important. You learn a huge amount just by dipping into virtual meetings. I'm doing it so much more than I used to. It's really helpful. Thank you all. Okay. Bye.
Thank you very much.
Bye-bye.